Hello everyone, and welcome to section 4, occupational safety and health. And this is topic A, chemical and waste management. Hopefully you have already completed section 3, which was on infection control, and that will serve as a foundation to this information here in these 3 topics that have to do with keeping ourselves and our environment safe. Let me just give you a quick overview of these 3 topics we're going to do here in this section. As you'll notice here on the right hand side, it's a copy of the Dental Board's outline for the RDA exam, and I'm using that as a reference to our sections and our topics. Thinking back to the infection control, remember you had topics A through G, and we finished here with topic G. Notice that there is an H in infection control, which was hazardous waste disposal. But if you look down here under occupational safety and health to chemical and waste management, it is really the same thing. And after looking at their more extensive exam plan, I did not see anything particular to the topic up here in infection control that wasn't covered down here in occupational safety and health. So I merged those 2 sections together, just calling it chemical and waste management. And I moved it up to A because to me, this information is foundational to the other 2 topics we need to cover. Then what I've done is merged A and B over here in the exam plan outline, injury, illness, and prevention, and exposure control, which are both covered in OSHA's bloodborne pathogen standard. So what I did was I took OSHA's bloodborne pathogen standard and broke it down into an easy to understand information and therefore, of course, podcast. So those 2 sections are merged together, and that's going to be B. And then topic C is on hazard communication. So as you can see, that is the 3rd topic there in occupational safety and health. Now, also notice that the occupational safety and health section, these 3 topics, is approximately 10% of 14 questions on the RDA exam. Again, you may be listening to this podcast in preparation for the RDA exam or for national board exams, for the infection control national exam, or for a continuing education class. But just as a reminder, if you are taking this for the RDA, you are preparing for 14 of your questions by watching these 3 podcasts. In addition, let me just take a second to go back and encourage you that if you have already completed these sections or the topics in section 3 infection control and you are preparing to take the RDA exam, you are prepared to take and pass 35 questions on the RDA exam. So be encouraged. You are a good percentage of the way there to be prepared to take and pass the RDA exam with these 35 questions of infection control and these 14 with occupational and safety and health. You are well on your way. Think about chemical and waste management as management of the environment in regards to infection control. So environmental infection control. When we talked about infection control already, we were pretty much talking about protecting your patients and protecting us. We were not talking about protecting the environment. So chemical and waste management is protection of the environment in regards to infection control. We are basically talking about 2 areas of concern. The first one is contaminated surfaces, so it is the environment of your dental office. And we've already covered this information. It's going to be review. We've already covered infection control, so I'll go through it quickly. And then the other area of concern is waste, which is infectious materials that could leave our, well, infectious and non-infectious, we'll talk about that in a second, materials that could leave your office and then go out into the environment. quick review of contaminated surfaces. There are clinical contact surfaces, which are the surfaces that we use and touch during the treatment of our patients. They have high potential for direct contamination from spray or spatter or by contact with the dental health care professional's gloved hands. And we're going to use intermediate surface disinfectants typically. And then we have the clinical housekeeping surfaces, which the housekeeping surfaces just mean the floors, the walls, things that do not come into contact with the floors, the walls, things that do not come into contact with patients or devices. They have limited risk of disease transmission, and typically we're going to use low-level surface disinfectants there. Here are pictures reviewing this information. Clinical contact surfaces on the left here would be light handles, the ultrasonic unit, countertops where we put our instruments and supplies, the bracket table, the operatory chair, other handles. So if contaminated with blood, we're going to use intermediate level disinfection, and if not contaminated with blood, low level disinfection would be fine. Definitely remember this for test purposes. And then your housekeeping surfaces, like I said, walls, the floor, countertops we do not use for clinical treatment, and we only need to use low-level disinfection on our housekeeping surfaces. With our clinical contact surfaces, we're going to use barriers or disinfectant. Make sure you know that you do not have to use both. Think of the purpose of a barrier. If a barrier really is an effective barrier, is preventing the contamination of the surface underneath, and you don't contaminate it upon removal of that barrier, all you have to do is place the barrier, use it, and remove it, and you would not have to wipe that surface with a disinfectant wipe. The problem comes into play when we are removing those barriers. We very often contaminate that underlying surface and therefore need to wipe as well. So barriers should be placed with clean, bare hands. Don't forget that. Remember, if you have gloves on, we're going to always assume they're contaminated. So we would not place barriers with contaminated gloves or contaminated hands. Barriers should be placed with clean, bare hands and then removed with gloved hands because you're removing that contamination, and again, without touching the underlying surface. Housekeeping surfaces are just cleaned with regular soap and water, again, low-level surface disinfectant. You're going to use mops and cloths. One of the things that the National Board exam emphasizes is to be sure to let your mops and cloths dry completely between uses, so that it doesn't help to harbor bacteria in the wet, moist environment. And then prepare cleaning solutions daily. What equipment would be required then when you're cleaning and disinfecting environmental surfaces? Goggles, mask, and nitrile exam gloves, goggles, mask, and utility gloves, goggles and utility gloves, or utility gloves only. The best answer to this is B here, goggles, mask, and utility gloves, but E, which you don't see, would actually be the best answer. And what would we add? How would we change that? We would add exam gloves to these, so it should be goggles, mask, exam gloves, and utility gloves, because remember, whenever you have utility gloves on, you should have a clean, non-contaminated pair of exam gloves on underneath, so that when you go to remove your utility gloves and you're touching those utility gloves that are contaminated, you are protected with a clean pair of exam gloves, which are much easier to get off pulling inside out without contaminating your hands. Other surfaces we want to consider would be the reception desk, computer keyboards, telephones, those kinds of things that could get contaminated throughout the day. You should never answer the phone with a pair of contaminated gloves on, but unfortunately it does happen. Likewise, you should never grab a patient's chart with your contaminated gloves on, but yes, that happens. And then we take that chart up to the front desk. The receptionist then grabs that chart and has potential for cross-contamination there. So we would like to think that our front desk is free from any disease-causing microorganism that may get transmitted from the back, but that is just not the case. And so you want to regularly clean and disinfect your reception desk, the computer keyboards, telephones, that kind of thing. As well as, of course, we know that many offices now have computers and keyboards in the operatories, and you should be using either a barrier over your keyboard, or they do have keyboards that are disinfectable, washable actually. If you've never seen one, they're very interesting. I haven't used one, but I've seen them. I don't know how sensitive they are to pressure and to the touch and that kind of thing, but they are disinfectable. You can actually spray disinfect them and run them underwater, and it does not hurt the keyboard. So if you don't want to use a barrier over the top, look into disinfectable keyboards. One of the things that has become popular in the last 5 to 10 years is going green, in that we want to be careful of what we're putting in our landfill. Think about everything that dentistry actually puts in the landfill with all of our disposable devices, instruments, barriers, all that stuff. It's amazing what dentistry puts in the landfill. I always tease my first year students when they first enroll in the dental assisting program at Sacramento City College that if they are an environmentalist, they are in the wrong business, because we are going to be an affront to their sensibilities on preserving the environment. So this is a little twist on the concept of using barriers or wiping. Remember, you do, as I said a couple minutes ago, you don't have to do both. Place a barrier and wipe that surface that had a barrier on it. And one of the things that many offices are doing now are not using barriers. Years ago, 10 years ago plus, it was very common to barrier everything. Your whole operatory room, the chair, everything just was covered in plastic. Now we've kind of gone away from that and are just disinfecting with chemicals, which is fine, but that also presents a potential hazard to the environment by putting all of those chemicals and disinfectant wipes in the garbage. So which would you prefer to do? Anyway, dentistry is going green along with the rest of America. Consider purchasing items that are most environmentally friendly. So something you might want to think about. Use disinfectants with chemicals that are not hazardous to the environment. And there was something else I was going to say there. Oh, use reusable items whenever possible. Now, by saying that, however, that is a school of thought to use reusable items whenever possible. But if you're taking an exam, if you're preparing for state and national exams, the correct answer on the exams for infection control, not environmental infection control, but for infection control, preventing cross-contamination or communication of communicable diseases to our patients, the correct answer would be to use disposable items whenever possible. So it all depends on your frame of reference, what you're really concerned with, and read the question carefully. Single-use disposable devices have the advantages of decreased cross-contamination, saves time, you can throw it away, prevents the need for cold sterile, which we talked about in infection control. The disadvantages, not usually heat tolerant, not able to sterilize them, can be costly to use. They're typically a cheaper quality, and they are not sterile. Remember, if you buy these plastic single-use items, we would not do that in surgical procedures typically, because these are not sterile in the packages that we get them. Think of how they're manufactured and the process that they go when they're being made. They're certainly washed and cleaned before they're bagged, but during that whole process of bagging and getting them sent to you and all that, they are not sterile items. Hopefully they are aseptic, free from disease-causing microorganisms, but they are not sterile. So if you're working in a surgical environment, you definitely want to use reusable items that you can sterilize and can keep sterilized. So it pretty much comes down to preference. Which one do you prefer? Which one does your office prefer? Disposable, single-use disposable, or sterilizable, all in preference and what works good for you. One area I like to make sure to cover in talking about this is impression trays, because many offices use the plastic impression trays as reusable items, not disposable, and they are meant to be disposable and not reused. But many offices do reuse them and put them in cold sterile, rinse them off, dry them, put them away, and reuse them, and that is not their intended use. Also know that with impression trays, plastic ones, they're much more flexible, so they're not going to be as accurate as if you were using the metal sterilizable impression trays. Next, we're going to talk about waste. So what we have talked about previously, hopefully most if not all of that was review for you, nice and easy. You might be snoozing, wake up, wake up, because this is going to be new information. So first we're going to talk about regulated versus non-regulated waste, and what does that mean? First of all, before you even really look at this picture here, let's talk about the word regulated. What do we mean by regulated? If there is a regulation, that means there's a rule. That means somebody has to put that rule into play. So regulation typically means that it's a rule or a policy that we must follow by some kind of agency that can enforce those regulations. Non-regulated medical waste then would mean things that do have no ruling. You can put them in regular garbage. Almost all medical waste in a dental office is non-regulated. In fact, I got somewhere, I didn't put it on here, but in preparing for these, I found somewhere that it says approximately 98% of our waste in dental offices on average are just regular waste that can go in our normal garbage. It's not considered infectious, and again, therefore you can throw away in regular garbage. So believe it or not, that 2x2 that the arrow is pointing to there has some blood on it, but that actually can go in regular garbage, not the tooth that's on the 2x2 to the right, but that 2x2 and actually the 2x2 underneath the tooth could go in regular garbage. I'll explain that further in a minute. Regulated medical waste, again, means that somebody has a ruling, a regulation, that you have to do something special with that waste. What we're going to talk about here first is biohazardous waste or infectious waste. Both of those terms encompassing the fact that it's coming from body tissues. So they have a potential risk of contamination during disposal. We're talking about sharps, blood and blood-saturated waste, and pathological waste. We'll talk more specifically about each one of those. After that, we'll talk about regulated waste that is not biological waste, not from body tissues, but could be harmful, and that is your chemicals. So that would also be regulated. So in your mind, just make sure you know the term regulated, and it'll help you with all of these terms that sometimes people get confused with: regulated versus non-regulated, biohazardous, sharps container, what is what. First consideration is to think, is it regulated or not regulated? And then if it is regulated, is it body tissues or is it chemicals? Both of which would be hazardous waste. First, let's talk about sharps. Again, this is biohazard waste products because it comes from or comes into contact with body tissues, and in this case, they're also sharp. For example, needles, orthodontic wires, broken instruments, scalpel blades, anything that is super sharp that comes in contact with body tissues needs to go in this sharps container. Think about the sharps container as serving two purposes. It is hard plastic and has a way of closing it so that you can't get back into it, and it is hard to get into it to get anything out of. and we cannot stick our hand into it so that we can't poke ourselves. So it is the purpose of sharps, but it also has the biohazard symbol on here because it's body tissues. So anything that has the potential of being sharp and covered with body tissues go in here. It's a sharps container, but it's also a biohazard sharps container. And I point that out because some people will put a blood soaked or saturated 2x2 into the sharps container. Well, I beg the question, is that 2x2 sharp? That would be no. So it doesn't go in this container. It does go in a biohazard container, but not in this sharps container. Sharps container is only for things that are sharp. Now, let's say you were practicing on a typodont, like this picture here in the bottom left corner of distal end cutting the arch wire here on a model on a typodont. There's no body tissues here, so would we have to put this end that we're cutting off into the sharps container? Well, yes, this is a sharps container. So even though it's not contaminated with blood in this case, because it was only used on a typodont, it does go in the sharps container. Has to be sharp to go in this container. Did I drive that point home yet or not? Yeah. Let's move on. A few things about handling sharps. Should be a red or orange puncture resistant container. And the containers are supposed to be at the point of use. What that means is you are supposed to have a sharps container wherever you've produced that sharp item, so you don't have to carry it somewhere else, and in the transportation from point A to point B, somebody could get poked or hurt by it. The translation to that means that you should have a sharps container in every operatory, because you are supposed to be disposing of your sharp objects, your needles, your orthodontic wires, scalpels, that kind of thing, in the operatories instead of carrying them, transporting them from the operatory to your sterilization area. One thing that many offices need to fix is, does your office have a sharps container in every operatory? If it produces sharps, if you produce sharps in that operatory, you're supposed to have one. Do not manipulate the needles before placing in the sharps container. What we mean by that is don't bend the needle or do anything to the needle besides recapping it before putting it in the sharps container. Years ago, when I first got into dentistry, I was taught to actually bend the needle in the sink. You kind of held it into the sink and pushed the end against the wall of the sink before putting it in the sharps container, and I was in that habit for so long that it was a really hard habit to break. New regulations, or not new, newer than 25 years ago, regulations are that you should not bend or manipulate your needle in any way before putting in the sharps container. Just put it straight in there. Use one-handed scoop method to recap needles or a recapping device. What that one-handed scoop method means, you absolutely do not hold the cap of the needle in one hand and then hold the syringe in the other and merge the two together. You might miss the cap and poke yourself. You want to leave the cap on a tray and scoop the needle into the cap and then tighten it once the needle is within the cap, and you won't hurt yourself tightening the cap on. Or use a recapping device of some kind. Close the lid securely before transporting if you were going to transport it from point A to point B. And you are to be wearing utility gloves when handling sharps. Blood and blood saturated waste. So here goes back to that 2x2 that I pointed to earlier that I said did not need to go into your biohazard container. Here's the ruling. Bullet 1, solid waste or cotton that is soaked or saturated with blood, or if the solid waste, that cotton, that is caked with dried blood such that if you were to compress it or squeeze it, it were to flake, those then need to go in biohazard container. So there's enough on the gauze, on the 2x2 cotton roll, whatever, that if you were to compress it, it were to drip or if it were dried, it were to flake, then it needs to go into a biohazard container. And notice this biohazard container, yep, biohazard, body tissues that are hazardous, but not a sharps container, right? Because it doesn't have the attached lid that you wouldn't be able to reach into. So hopefully you have that down, and think about in your office, if you work in a general dental office, how much of the waste that you're producing on your disposable items, your 2x2s, cotton rolls, how much of it is soaked with blood, or if it were to dry, it would have so much on it that it would flake if you were to compress it. Not much. Not in a general dental office. It's pretty rare. So that's why some offices actually don't have a biohazard container other than the sharps container, and why some people put their 2x2s in that sharps container. They have no other biohazard container to put it in. That is against regulations. You are supposed to have a separate biohazard container so that when you do produce items that are supposed to go in there that are not sharp, you have that biohazard container. Hopefully you have one. What do we do with extracted teeth? You do need to put it in the biohazard waste container. Again, not in the sharps container, but in the separate biohazard waste container. If you're shipping it somewhere, which I would imagine is pretty uncommon, but if you're shipping it somewhere, say a lab for a shade check or an educational facility, it has to be high level disinfected or heat sterilized prior to sending it. Now the problem though with heat sterilizing is, next bullet, do not heat sterilize teeth that have amalgam in them. Amalgam, when it is heated, puts the mercury into the vapors, into the air, and then you inhale it. The biggest controversy or problem with amalgam is we're talking about, or when we talk about amalgam, we'll get much more extensive into this, but the biggest hazard with it is the inhalation of it into our lungs. It is not swallowing it, it's not touching it and getting it into our body through our skin. It is inhaling it. So when we put a tooth that has amalgam in it into a sterilizer, and then as it depressurizes and the vapors come out into the room and we're inhaling it, we're actually inhaling mercury vapors, and that is very, very toxic. So you do not put these teeth with amalgam in the sharps container, because the sharps container, when your companies come and take it away, they incinerate that material. They actually heat it up to very high temperatures to incinerate it, and again, those mercury vapors would be harmful. You can give extracted teeth to your patients. Years ago, again, we used to say you can't let, the doctor would have to deem the tooth non-infectious before giving it to your patient. And that just isn't true. You can give the teeth to the patients. It's a good idea to disinfect it first, wipe it off of any soft tissue and disinfect it before giving it to the patient to minimize the infection leaving your office. However, once the tooth leaves your office, you are no longer responsible for its disposal, and it's kind of a loophole in the system there. Seems kind of odd, but you can give extracted teeth to your patients. In many educational settings, in schools, dental schools, hygiene schools, assisting programs, we may use extracted teeth for various reasons. First, you would want to, if somebody asks you for extracted teeth from your office, first you'd want to remove visible blood and debris. You would want to maintain their hydration until they're sterilized, so you'd want to keep them in water or something so that they stay hydrated. The more dehydrated they get, the more brittle they are. They change shade, they change color, they're more brittle, and so they're not true to whatever purpose or function they're going to be used for in the educational setting. Again, do not autoclave or sterilize extracted teeth with amalgam. And then the teeth with amalgam should be so, and this is weird, this again, not something that anybody other than people that are studying for your state and national boards need to know, but teeth with amalgam should be soaked in 10% formalin solution for 14 days to disinfect the internal and external surfaces. I have never seen anybody do that. I've never heard of that anywhere except on study materials preparing for national infection control exams. So, good information to know. Probably won't ever see it again or see it in your office. And then the last biohazardous waste that comes from body tissues, is pathological waste, meaning biopsy specimens or excised hard or soft tissue. You would put those tissues into a sturdy plastic container, a single-use leak-proof container of some kind. Avoid contaminating the outside of the container. Label the container with a biohazard symbol, and then place that specimen container in a larger biohazard container for disposal. Or if you were sending that biopsy off to a company or something, of course you would package it according to their package directions. Now, what if the outside of that biohazard container became contaminated? What would you need to do? In that case, you would then need to, without contaminating the next jar or container, put that contaminated container into something else that is not contaminated. So you are not transferring contamination from the outside of the container. All right, and then hazardous waste, that is chemicals, not biohazard, just hazardous to the environment chemicals. There are many things in your office that may be considered hazardous waste, and we certainly are not going to address all of them here. We've gotten better with the digital age. We have less and less chemical use items. For example, the last bullet there, fixer solution, is solution when we're processing X-ray films. Now, if you work in an office that is completely computerized or digital, you don't have to worry about that solution, and that takes care of that. If you work in an office that does not place amalgam restorations, the only hazardous waste you'll have with amalgam is then any amalgams that are taken out of your patient's mouth and then replaced with composite or whatever. So you don't have much scrap amalgam. You just have some of the amalgam that may go into your traps from the removal of teeth. I'm working from the bottom up here. Unexposed X-ray film, so film that has not been exposed, and that's a key here as well. If it has been exposed, there's no hazard to it, but unexposed, have chemicals on the film itself, would need to go into a hazardous waste container. Or the lead, and the lead from the packet needs to be taken away by a hazardous waste company so that that lead foil does not get put into our landfill. Again, there could be many other things that you have in your office that are considered hazardous. You would need to read the manufacturer's instructions on them to see if they're environmentally safe or not. And of course, when in doubt, consult who's the organization that controls or has the regulation about what is hazardous and what is not. That would be the EPA, the Environmental Protection Agency. So when in doubt, check with the EPA to find out if your chemical or what you're disposing of is hazardous and how it should be disposed of. So a logical question here would be, just to understand the terms, is hazardous waste regulated? Absolutely. If it's hazardous, that means somebody is telling you that they have a regulation that you have to deal with it correctly. So hazardous waste, of course, would be regulated. All right, almost done. We have some food for thought here and some miscellaneous information. Question: where would disposable gowns be disposed of? What do you think? In sharps, biohazard, regular trash, or recycle? What do you think? You probably got this wrong. Sorry. You probably answered regular trash. Now, if it was soaked with blood, or if the blood dried and it were to flake, would you have to put that in biohazard? Yes. Again, not typical unless you're in a surgical environment where you got a lot of blood all over you. You are in orthognathic surgery and we did a major surgical case. Other than that, it pretty much goes in regular trash. But this is a trick question because many, I can't say all or maybe even most, but some recycle companies will recycle these gowns. I know at SCC, our recycling company does recycle our gowns, even if they're contaminated. Not saturated, but contaminated such that they would go in regular trash. So we have separate blue bagged trash bins where we put these gowns so that they can be recycled. And again, that's going to help the environment. So I would encourage you to check with your recycle company or your biohazardous waste company to see if they have a recycling division. Find out if your disposable gowns could be recycled. Would be a great idea. Where would this one be disposed of? Sharps, biohazard, trash, recycle. Not recycle and not sharps. So does it go in the regular trash or biohazard? That would depend on if it were to flake or compress it. If it were dry, would it flake? Or wet, would it drip? Doesn't really look like it, but this is kind of in the medium zone. I'm not exactly sure. So when in doubt, put it in the biohazard. Barriers, where would they go? Pretty obvious, regular trash. Tooth. Yes, you got this right, I'm sure. Biohazard. Sharps container? No, because it is not sharp. And this particular one looks like it's got decay but does not have amalgam in it. So we probably could put that one in a sterilizer to sterilize it if we were going to use it for any educational purposes or send it outside of our lab or office for some reason. But we'd wipe off the blood and tissues off of there first. This is a extraction of a cyst. So they excise the tissue, they pull out this cyst. We have this piece of body tissue. Where would that need to go? Definitely biohazard. Now, one more trick question. What about the anesthetic carpule? Where does the used anesthetic carpule go? Well, we already know that the syringe, of course, gets sterilized. The needle goes in the sharps container. But where would the carpule itself go? Many offices put it in the sharps container. Do you have to? My question to you is it sharp? No, it is not sharp. Now, a lot of people say, well, if it breaks, it'd be sharp. Well, you're right. If it broke, it would be sharp, and then it would need to go in the sharps container. But at the time that you dispose of it, it is not sharp. It does not need to go in the sharps container. Does it need to go in the biohazard container? Question would be, is it sealed? Is anything dripping or flaking off of it? Even if there was blood inside it, it is sealed such that you would not need to put it into the biohazard container. Regular garbage. Believe it or not, don't argue with, don't be mad at me. You can argue with me all you want, but that is the regulations. Would touching them be potentially hazardous beyond normal conditions? And that's kind of the baseline. What are normal conditions? Nope, regular garbage. Do you have to express out the rest of the anesthetic? If there was any left in there, would you have to express that out before throwing it away? I have never seen that anywhere. If you've seen that anywhere of reputable locations, certainly contact us and let us know that, but I have never seen that you have to express out the rest of the anesthetic before throwing it away. Regular garbage, there it goes. Which of the following is or are considered waste that is generated and may be disposed of in the general trash? Exam gloves, lightly bloodied gauze, anesthetic carpules, matrix bands. Hopefully you answered all of the above. I don't know why I put this here. Refrigerators. If you had a refrigerator in your back office, and most offices do have a break room of some kind or whatever, just know you cannot cross and put your lunch, your pizza, your soda, or especially your chocolate in the same refrigerator as you put your dental supplies. Many offices have a special refrigerator for their dental supplies. No cross-contaminating of those supplies with your food. Can't do it. And voila! That's all the singing you get from me. We are done. Next topic is topic B, OSHA's bloodborne pathogen standard. I will talk to you there. Bye-bye. Don't forget to take the quiz.